morning, good afternoon, and good evening, everybody. Welcome to another week of the Global Cafe. My name is Elizabeth Lewis, and I'm a Senior Policy and Project Coordinator here at the IFA. And I'm very excited to be introducing you all to Dr. Andrew Budson. He's educated at Haverford College and Harvard Medical School. Dr. Andrew Budson is Chief of Cognitive Behavioral Neurology at the VA Boston Healthcare System, Associate Director of the Boston University Alzheimer's Disease Research Center, Professor of Neurology at Boston University, and lecturer in neurology at Harvard Medical School. He has written 9 books, including Memory Loss, Alzheimer's Disease and Dementia, A Practical Guide for Clinicians, 6 Steps to Managing Alzheimer's Disease and Dementia, A Guide for Families, 7 Steps to Managing Your Aging Memory, and his latest book for everyone, Why We Forget and How to Remember, The Science Behind Memory. His books have been or are being translated into Japanese, Chinese, Korean, Portuguese, Spanish, Greek, Arabic, and Lithuanian. So as you can see, Dr. Budson's very accomplished, and we're highly excited to have him here today on Global Cafe with us. So welcome.
Thanks so much for having me.
So our first question for you, just to get to know you a bit better, can you tell us about your current role and affiliations and where your passion for dementia and brain health research first began?
Sure. So my main job is taking care of our military veterans in the United States at the VA Boston Healthcare Systems. I'm based in Boston, Massachusetts. And I'm also, as you had read, the Associate Director of our Boston University Alzheimer's Disease Research Center, where we work very hard to be able to treat people with Alzheimer's in all stages of the disease and working towards a cure for Alzheimer's someday.
Okay, wonderful. And when did you first get into this research? How did you first get involved?
Yeah, so I've been interested in understanding the relationship between memory and thinking and consciousness and things like that, and how do these relate to the underlying brain and the neurons firing since I was in high school. And
Wow.
and yeah, this actually led me to become a chemistry philosophy double major in college, trying to
Cool.
get at sort of both sides of the issue.
Mhm.
And then when I was deciding, what to do with my life, it seemed very clear that the best way to answer these questions were to work with people. And so I went to medical school, and it became very clear to me that not only was this a good way to better understand these scientific principles, but a wonderful way to help people as well. And so I became a neurologist and then a cognitive behavioral neurologist to combine my interest in understanding mind-brain relationships with being able to help people.
Okay, very cool. Thank you for sharing. Could you explain for our audience what brain health more generally means and why it's important to consider at all stages of life?
Yeah, so brain health is sort of like it sounds, is
Mhm.
simply to make sure that we are caring for the health of the most important organ in the body,
Mhm.
and that is our brain. And the reason that we and others have begun to talk about brain health as sort of a general concept is, rather than thinking about, well, when people are young, we have to worry about, head injuries, and then when they're older, they have to worry about dementia. We think of it now as sort of a continuum, that you want to have good brain health throughout your life. And this is in part because what happens when we are young actually affects how our brain works when we are older. And
Right.
so it's very important not only to avoid a head injury when you're young, for its own sake, but if you have head injuries when you're young, you're more likely to develop cognitive problems when you're older. And in some of the work that I have been involved with a number of colleagues, We've learned, for example, that if you participate in boxing or you play American football, that you can end up with a dementia later on related to the multiple injuries that you had in your head when you're young. And
Okay.
so this is an example of where we think about brain health throughout the entire lifespan.
Mm-hmm. No, that's very interesting. Thank you for sharing. Are there specific signs that people should pay attention to when considering their brain health and maybe how would that differ across the life course as well?
Well, I think one of the important things to do across the entire lifespan is to develop healthy habits.
Okay.
So, for example, it's important to eat a healthy diet, which includes several principles, one of which is we want to be eating whole foods rather than highly processed food. So the more whole foods, foods more or less in their natural state, the better. The other thing is that the Mediterranean menu of food, broadly, is the diet that's been shown through now several thousand studies to be the healthy type of diet that includes fish, olive oil, avocados, fruits and vegetables, nuts and beans, and whole grains. And then from a sister diet that's been studied, we can pull in poultry as well. So eating those types of foods and whole grains throughout your life is very important. So when people are young, they often don't worry about what they eat. They eat
Yeah.
junk, a lot of sugar, a lot of processed chips and cereals. But really, it's important to get into those habits throughout your life.
Mm-hmm. Hmm. And are there signs that we can maybe point to that can catch cognitive decline a bit earlier on, or what are some signs that indicate either poor or good brain health?
So I think that for older people, the types of signs that we would be looking for would be, if somebody's, 75 years of age or older, and they're beginning to, say, ask the same question more than once, telling the same story to the same people over and over again. They're getting lost on familiar routes. Those would all be signs that something may not be right.
Okay. Okay. And I really like the comments you made bringing attention to the diet aspect and how that can contribute to a healthy brain. Are there any other sort of everyday habits that people can get into the practice of that contribute to cognitive well-being?
Yes, absolutely. So the other is aerobic exercise. That's also very important. And it's also something that one really should start to do early in life.
Mm.
And so it would be, wonderful if everyone was spending at least 30 minutes a day, at least 5 days a week, participating in some type of aerobic exercise. So it's important to get into that habit
Mm.
early. I was just talking with a friend of mine, and he has now developed a little bit of type 2 diabetes and needs to sort of start exercising to reduce a little weight and and be healthier. And it's the sort of thing that if he had been exercising regularly his entire life, this probably would not have come up. Now, having said that, some diseases happen to people for reasons that we don't understand, but there are a lot of things that we can do that we do understand to prevent. And when it comes to exercise, doing things, for example, like, walking up the stairs is actually very important. My office, where I'm speaking to you from today, is on the 6th floor of our building. and I just routinely walk up the stairs. And sure, the first time you walk up the stairs, you may be huffing and puffing, but when it becomes a habit and part of your routine, then it takes less effort. And, rather than seek out opportunities to, walk less, seek out opportunities to walk more. Don't park your car as close as you can to the shopping center. Park your car as far as you can from the shopping center.
Right.
So you have to do a little bit of extra exercise.
Okay, I like that. Thank you for those tips. We have a comment in the chat that is similar to our conversation now, so I'm going to read it here. And it says it's from Shmuel, one of our cafe regulars, and he's asking, how does employment and active life support improvement of cognition amongst older persons?
Yeah. So another important habit that I think happens for most of us automatically when we're younger, but gets much more difficult when we're older is to stay socially engaged in life.
Mhm.
And for most of us, when we're young, this often means going to school. And then as we get a little bit older, it's often when we're working. That is sort of our main environment when we're seeing other people outside of our own household. And so for people to continue to work as they get older is absolutely fantastic because it's one way that they can stay not only cognitively engaged, which even by itself is an important thing to do to stay cognitively engaged, but also to stay socially engaged. So working helps us to keep our mind active and also helps to keep our social engagement going. And the reason we think social engagement is important is that the brain almost certainly evolved in large part to navigate complex social interactions. And so when we have social interactions, that's one of the times that we're activating much of our brain. So it's very important.
Thank you. Thank you for sharing that. And hopefully that answered your question more, Shmuel. So we've talked a bit about how diet and exercise and social engagement can influence brain health. I'm curious if there's any research you can speak to on the impacts of sleep as well.
Yeah. So sleep is critically important uh, for normal brain functioning. And I'll tell you at least three reasons why. So the first is what I think of as sort of the obvious reason, which
Mm,
is that if you don't get good sleep, you're often going to be tired the
mm,
next day. And if
mm,
you're tired, it's hard to pay attention. And
mm,
the essence of memory is paying attention. What we pay attention to is what we remember. And the better we pay attention, the more likely we are to remember that information. So that's one reason sleep is important. Another reason that sleep is important has to actually do with its cleansing effect of the brain.
mm,
So while we are awake, we all make a little bit of this protein called beta amyloid. Now, having some normal levels of beta amyloid is actually a good thing. It helps to protect the brain from infections. But if we get too much beta amyloid, it can actually cause Alzheimer's disease. That's what's inside these Alzheimer's plaques is
mm,
beta amyloid. And what happens when we sleep is that the amyloid that we make during the day gets flushed out while we're sleeping. So we
mm,
need to give ourselves enough hours to sleep to allow this flushing out of the amyloid to occur. And
mm,
the third reason that sleep is important for thinking and memory is that we all make a certain number of memories while we are awake. And these memories are only in a temporary storage form. And it's when we sleep that they go into a more permanent or at
mm,
least long-lasting storage form. This
mm,
transition is called consolidation. And
mm,
if we don't get a good night's sleep, we're not going to be able to consolidate our memories and we won't be able to hang on to them for a lifetime. So those are three of the reasons that sleep is very important for brain health.
Well, that's super interesting. I'm learning so much already. Thank you for that. I'm curious how much these factors that are sort of measures that one can take into their own hands, how much those influence versus maybe predisposed genetic factors. If there's a, I don't know if there's a way that
Yep.
you can tell, but
Well, yes, in fact, I can give you numbers on this because
okay.
this has been studied and it was published in a paper last year, 2024, in the journal Lancet. And
Mm,
what they estimated is that although approximately 55% of the factors that lead people to develop dementia are set and include things like your genes, 45% of factors are not uh,
okay.
and actually are modifiable.
Mm,
And these include things again throughout the lifespan. So it includes education, as
mm,
more education is protective against dementia. It includes the diet and exercise and social engagement and cognitive engagement that I was mentioning, but it also includes things like pollution,
mm,
things that we can work together as a society. And as an individual, we've all gotten a little bit used to wearing masks from the pandemic. And if you're in an area that has a lot of pollution, it's reasonable to wear a mask. Try to reduce your own um, intake of pollution. Another thing that's actually one of the most important risk factors is actually hearing loss. And
mhm,
hearing loss is something that can be corrected through hearing aids. And so this is an example of something that now that we have been studying it, we realize how important it is. It's estimated that 7% of the dementias that are currently present could have been prevented if
mm,
people simply wore hearing aids when
mhm,
they began to develop hearing loss. It's
mhm,
felt that not hearing well, number one, it isolates you socially because you can't participate in the conversations because you can't hear them. And then
mhm,
many people begin to withdraw and stop going to social events because they say, oh, I'm not going to be able to hear anything anyways, and leads to further social isolation. So 45% of the factors can be modified.
yeah, that's fairly high, but that's also maybe encouraging to think that
Yes, absolutely.
there is some steps we can take to preserve our brain health.
Yes.
So I'm curious what for maybe there's some folks in the audience that are listening to this conversation and thinking that they want to engage with their primary care provider about some conversations about cognitive health or hearing health. What are some common fears or obstacles that people face when initiating conversations about brain health with their healthcare provider? And what are some steps that they could maybe take to prepare for these conversations?
Yeah. So I think that, the most common fear
Mm,
would be, people are concerned that they may be developing, Alzheimer's disease or another type of dementia. And so they don't want to say anything to their provider because, they don't want to get bad news.
mm,
Well, the fact of the matter is that, many causes of memory loss are very easily treated. So, for example, people can have memory loss from vitamin B12 deficiency, and you
mm,
may have no way of knowing if your B12 is low without getting it measured. Even if you eat a normal diet, the same diet you've been eating for years, as people get older, they sometimes develop difficulty absorbing B12.
mm,
So that's just one example.
mm,
Another common cause of memory loss that your physician can help you with is related to medication side effects.
mm,
And that's actually one of the more common
mm,
problems that I see. Um, especially in people under the age of 60.
Mm,
Uh, we talked about sleep a little bit. So it turns out there are a lot of treatable sleep disorders. You may not even realize that you're having a sleep problem. And so speaking with your physician really is important. And the other reason it's important to speak with your physician is that uh, common medical diseases like high blood pressure, high cholesterol, these can predispose you to things that impact your brain, not only Alzheimer's disease and dementia, but also strokes. And so it's important to work with your doctor and make sure that these things are under good control. And I'll
mhm,
also tell you a little hint, which your doctor may or may not say, which is that if you can control your blood pressure, your cholesterol, your blood sugars by diet and exercise, that
mhm,
ends up being better for your overall health versus controlling these things with medications. So we
mhm,
really want you to get into these healthy habits, exercise, eat right, so you can be in charge of controlling these risk factors. Not only is it good psychologically, but it's good for you biologically.
mhm, mhm. What an important message. Thank you for sharing that with everyone. Are there any sort of notes or ways that patients can provide additional information and preparations for their healthcare provider that would be useful?
Yes, absolutely. So one team that I have partnered with is the Academy for Continued Healthcare Learning, and they have developed a nice website that I helped create as well, and it's called www.brainhealthmatters.org. So Brain Health Matters, all as one word, .org. And this has this site has both a tab for healthcare professionals to help them better take care of people, as well as for individuals and what they all can do for themselves. So that's one good resource. And of course, you were kind enough to mention my books in the beginning. It's another resource people can use.
Perfect. Thank you for that. And yeah, we've put that link in the chat there. So if anyone's curious to go check out those resources, please, we highly encourage you to check those out. So thank you for that. We also have another question in the chat here from Hamid. If you are here and you want to unmute yourself to ask the question, please feel free to. Otherwise, I can read it aloud here.
Oh, sure. Thank you. Thank you, Dr. Budson. That was great insight into how we potentially can prevent dementia. I was wondering if you can share your thoughts on those individuals who have shown to have brain imaging amyloid load in their brain, quite high level, similar to Alzheimer's patients, and yet they're performing cognitively normal in cognitive measures. Um, do you think this is more of a risk factor related sort of resilience, or are there other factors that you think are important? Thank you.
Okay, so if I understand the question correctly, it's there's some people that have high levels of amyloid in the brain, and yet their cognitive function is normal. Is that correct? Yeah. So the most common reason that that's the case has to do with the underlying pathology of Alzheimer's disease. So we in the medical scientific field believe that Alzheimer's disease starts with this deposition of amyloid. But as I mentioned earlier, amyloid has a normal function. Many of us, including me, believe its normal function is to help the brain fight off infections. And so amyloid only becomes a problem when there becomes too much amyloid in the brain. and it starts to disrupt initially the transmission between different neurons, between different brain cells, and then ultimately begins to damage the brain cells. And this is usually part of an inflammatory process. And again, as the normal function of the amyloid is to fight off infections, an inflammatory process often accompanies it. Once the brain is filled with amyloid, once you get this inflammatory process, the cells themselves begin to be damaged. And inside the cell, another protein called tau, TAU, gets loose. And the tau is very sticky. And it sticks to itself and it forms these long chains. And the chains can get literally tangled up inside the brain. And these are the tangles in Alzheimer's along with the plaques. And once the tangles form inside the brain cell, it kills the cell. And so it's when the tangles start to form, that's what causes the memory loss of Alzheimer's disease. And the other thing we've learned about these tangles is that even when you remove all the amyloid plaques from the brain, the tangles can still spread from neuron to neuron, causing the death of more cells. So amyloid is just one piece of the puzzle, and there's also these tangles that are important too.
Thank you, Dr. Budson, and hopefully that provided some clarity for you there as well, Hamid. We have another question in the chat here from Monique. If you want to unmute to ask your question, you're welcome to. Otherwise, I can read it out here. Okay, so Monique is asking, I heard recently in the news that getting the shingles vaccine can reduce our risk of dementia. Would you comment on this?
Yes, of course. And I hope that it now makes perfect sense to you as to why this would be the case. So if the normal function of beta amyloid is to fight off infections, whenever we have an infection that's attacking the brain, amyloid is going to come in to help the brain take care of it and get rid of that infection. So by getting the shingles vaccine, and similar results have also been shown for the flu vaccine and the COVID vaccine, by getting these vaccines, we prevent that brain infection from ever starting. The shingles, I think, may be particularly important because shingles is an infection of neurons. It's an infection of brain cells and other nervous system cells. So this is the reason that it's relevant. It has to do with this normal function of beta amyloid, and so we can prevent beta amyloid deposition by not getting infections. I'll mention one other relevant thing, which is it's been noticed now for more than 15 years that low levels of vitamin D have been associated with Alzheimer's disease and other forms of dementia. And the link is thought to be because vitamin D is actually very important for our immune system. And if our vitamin D levels are low, our immune systems don't work as well, and we're more likely to get infections, including brain infections. So the bottom line is you should work to stay as healthy as you can. And that includes getting vaccinated with all the normal vaccines. And it also includes making sure your vitamin D levels are normal. Now, we can all make some vitamin D when your skin is exposed to sunlight, but most of us follow the advice of our dermatologists, and we put sunblock on, which is good to protect our skin from skin cancers, but actually blocks that ability to make vitamin D. So we end up having to get it from food. In the United States, milk is often supplemented with vitamin D, but as we move from childhood to adulthood, many of us don't drink so much milk.
Yeah.
So you have to, figure out how you're going to get your vitamin D. You might want to ask your doctor to check your vitamin D levels if you're not sure. Or you can take an over-the-counter supplement. I confess, I myself take an over-the-counter vitamin D 2,000 international units each day to keep my own vitamin D levels normal, because I live in the Northeast in the United States, where the sun does not shine enough hours of the day.
Oh, thank you for that. That's great advice for my colleagues and I in Toronto, Canada as well. So
Absolutely relevant for Toronto as well.
yeah. And another comment in the chat here from Jim. If you want to unmute, you're welcome to. Otherwise, I will also read it aloud. And Jim is asking, I've seen opinions that dementia is a type 3 diabetes. Is there any comments you can make on that?
Yeah. So I think that I have seen people talk about that as well. I don't see the link that strongly. I would not describe Alzheimer's as type 3 diabetes. But for sure, it's not good to have high levels of insulin for the brain. And this can be bad for a couple different reasons. When the insulin levels are high, it ends up driving the sugars out of the cell that the brain needs, and then it also ends up making us hungry, and we tend to end up eating more. And you can avoid these sort of high spikes of insulin by, instead of having refined sugar and refined flour, which is very quickly turned into sugars, and white rice, the same issue there, very quickly turned into sugar, by simply having whole grains. That's a much better way to do it. So it's very important to keep your whole metabolic system going well by eating whole foods. It's also important to maintain a healthy body weight so we don't develop metabolic syndrome that leads to type 2 diabetes. But I personally think it's a bit of an overstatement to call Alzheimer's type 3 diabetes.
Okay, thank you for clearing that up. I think maybe now is a good time to also talk about what some reliable sources for learning about dementia and brain health are, and how folks can identify what a good source and maybe not so good source would be.
Right. Well, as we mentioned earlier, the website brainhealthmatters.org is one good source of information that I worked with a company to develop. And other good sources in the United States would be the NIH, the National Institutes of Health websites, and specifically within NIH, there's NIA, which is the National Institute on Aging. These are good sources of information. And there are similar websites in other countries. I know the NHS in the UK would be a good source. So specifically for dementia in the United States, the Alzheimer's Association would be a good source of information. So a lot of these different places are good to get information from.
Yeah, thank you for sharing those. And do you have any tips for folks to help them distinguish between credible and misleading information on brain health and treatment options?
It's a good question. And I do think there is a lot of misinformation out there. I'll mention a few things specifically.
Mm.
So there's a company that makes this drug called Prevagen that is marketed quite a lot in the United States, and they have television ads and everything else. And there's no evidence whatsoever that it's helpful. And a lot of my patients have spent quite a lot of money on these drugs that don't do anything. So I caution people about that. The other thing I'll mention is there are no supplements that have been shown to be beneficial, and no vitamins that are beneficial unless you're low in
Mm. Mm.
the amount. So I mentioned two vitamins, B12 and vitamin D. These are actually vitamin levels that I measure in all of my patients when they come to see me. And it's perfectly reasonable, at almost at any age, but particularly middle-aged and older, to check and make sure your levels of these vitamins are normal. But there's no evidence in taking sort of mega doses of any of these vitamins. There are some supplements that people are, hoping would be helpful, but they've just not been proven yet. So these include resveratrol, that's found in blueberries and red wine. It includes turmeric, part of curries. It includes ginkgo biloba, an herb. It includes lion's mane. None of these things have been proven to be effective. Many of them, including resveratrol and turmeric, are not harmful.
Right.
I love a good curry and am happy to eat plenty of turmeric, but I don't do it for my brain health. I do it because I enjoy the taste.
Mhm. Thank you for that. We have some more questions in the chat here. We have one that's asking, at what age or stage should we start doing cognitive testing or evaluation as a preventative measure?
Yeah. So we're moving into an age where we have these new medications, and it's probably worth spending a minute talking about them. So when I started my specialty training in memory disorders, that was 1997. And at that time, there was just emerging a new class of medications that would stop the breakdown of a chemical called acetylcholine, which would then allow the levels of acetylcholine in the brain, which actually in Alzheimer's disease, they drop. It allows to bring those levels back to normal. And so this was a wonderful breakthrough. We haven't had a new class of medications in Alzheimer's disease for 20 years. And now, starting in 2023, we actually have a new class of medications that's actually working well. So these are the medications that target amyloid by using an antibody that's given by vein, injected into the bloodstream either every 2 weeks or every 4 weeks. And, it's a lot of work, and they have side effects that it can include brain swelling or brain bleeding. So it's not for the faint of heart, but these are the only medications that can actually remove those amyloid plaques from the brain. And what the studies show is, although it cannot cure Alzheimer's, nor can it stop it, it can slow down the progression. So instead of somebody declining rather rapidly, they decline more slowly. And these medications have been proven to be helpful for individuals in the early stages of Alzheimer's disease, when they either don't have any functional problems, even though their thinking and memory aren't perfect, or their function is just a little bit impaired. And so because of this, we're moving into an age where we actually do want to monitor people as they get older, because if they're beginning to show the early stages of Alzheimer's, we can jump on them and give them these new medications that can really help. So to answer the question, it's now recommended that when people reach the age of 65, they begin to have routine screening for Alzheimer's disease and other types of dementia. I'm actually, I frequently work with primary care teams. I gave a talk yesterday to an audience of about 800 primary care providers and talked about how important it is that as the primary care provider, they begin to do a little bit of pencil and paper testing with their patients, to talk to their patients about how is their brain health going? You know, do they have any trouble? Are they getting lost? Are they having word finding difficulties? Anything like that? And it's often important to speak with family members as well, because often the family member may notice something sooner than the individual may notice it. So given that we have these new medications that can slow down the decline in Alzheimer's, the current recommendations are, you know, to start regular yearly screening at age 65.
Thank you so much for that. That's all very, very useful information. So thank you for sharing. I definitely want to cover that family aspect piece as well, and the caregiver support networks for folks with dementia. So I guess my first question on that area is, do you have any tips or advice for family members of folks who are maybe starting to have signs of cognitive decline, and what family members or friends should do if they're noticing that their loved one is showing signs?
Absolutely. So in the very early stages, you know, when someone's just beginning to show a little bit of changes, you know, the family members and friends can, you know, simply say, hey, you know, I've noticed that you're having a little bit of trouble with your memory. And the funny thing about memory problems is literally people can have trouble remembering all the times they forget things. So,
Yeah.
you know, that little bit of information from a friend or a family member can be very helpful. And the other thing that you all now know that not everybody knows is that, number one, memory problems can be caused by all sorts of very treatable things, like vitamin deficiencies, medication side effects, thyroid disorders. There's a lot of very simple things that can be easily fixed if someone is showing memory trouble. So that's, you know, one good reason to encourage people to see their doctor. And now you also now all know that even if it turns out to be something like Alzheimer's disease, that we can help with that as well. So, you know, there's every reason to encourage people to see their doctors early. If you wait too long, problems only get worse. So, for example, B12 deficiency can become much more difficult to treat and cause a lot of problems if you let the levels drop too low. You know, why should you suffer from a medication side effect, you know, for a long time, you know, when that could be resolved quickly? There are even things as scary as brain tumors that can be easily removed if you catch it early, and can be a big a problem or be unoperable if you wait too long. And then finally, Alzheimer's disease, as we talked about, the medications have shown efficacy if we catch it early and not if you wait too long.
Thank you. And have do you have any tips for folks who are just starting their caregiver journey, or any advice of how they can prepare themselves for some challenges that might arise in providing
Yeah.
care?
Yes. Well, again, as you mentioned early on, I do have a whole book on this
Yeah.
for a caregiver. And the thing to keep in mind, I mean, there's a whole bunch of things to keep in mind. So one thing is, make sure your loved one has a proper diagnosis. Dementia is just a general category of disease, and if you went to the doctor because you had pain in your head and your doctor said, "Oh, I know what you have. You have a headache. That's your problem." And you're like, "Yeah, okay, I know I have a headache, but you want to know what's causing it." So if you or your loved one goes to the doctor and they come back and saying, "Oh, you have dementia," that's like saying you have a headache. It's correct, but it's really not useful information. You want to find out, well, what's the cause of that dementia? So make sure your loved one had a good diagnosis. So that's the first step. The second is to work on managing the problems that come up with dementia in as best you can without pharmacology. And so, for example, there's a general approach if somebody is, if one's loved one with dementia is getting upset or agitated, we call it the 4 Rs. So we want to reassure the individual that everything's okay. We want to reconsider things from their perspective, because when we consider things from their perspective, it often becomes intuitively obvious why they're upset or what we can do to improve things. The third R is to redirect them from things that are upsetting to things that are both calming and distracting. And the fourth thing is for all of us caregivers to take in a deep breath, to relax, because if we are getting frustrated or irritated, we may reflect that emotion to the patient and just escalate the situation. And so there's all sorts of tips that people can learn, not only for these sort of general problems, but for specific problems like hallucinations, like language problems, problems with bodily functions like incontinence. There's all sorts of different things that we can do. Then the next step we want to do is to look at the medications that our loved one is taking. Turns out many medications, even if they were fine when the person is younger, they can actually cause side effects and make the dementia worse, make the thinking and memory worse. They can make the behavior worse. So it's very important to look through these different classes of medications, and it's something that we put right into our book, is like all the different names of the medications that can actually cause trouble. And then you want to think about with your doctor, what are the medications that can actually make things better? And my general principle is we want to work first to help improve cognition, because of course the individual didn't have problems with, say, agitation or aggression when their thinking and memory was better. So if we can make their thinking and memory better, then it's going to help them. Then the second approach are medications to help them be a little bit more calm. That might be like a medication in the Prozac family, such as
Okay.
sertraline, brand name Zoloft, or escitalopram, brand name Lexapro. And then, only if those don't work do we try more powerful medications. It's also important to take care of yourself, because you can't be a good caregiver if your own health is suffering. You can't pour from an empty cup. And you want to engage friends and families to help you, because no one person can take care of someone with dementia. It really takes a team. We also encourage you to work hard to sustain your relationship with your loved one. And then it's also important to plan for the future and think about the things that are coming up, be proactive. So there's going to be surprises along the way, but at least let's have as few surprises as possible. So try to have better planning. So those are some of the important steps.
Thank you. And you mentioned earlier that you had some resource suggestions for the patient side of things as well as the caregiver side of things. Could you elaborate a bit more on good resources or learning sources for folks who are caregivers that want to learn a bit more?
So in terms of brain health, there's the website we've mentioned now a couple of times, this brainhealthmatters.org. For caregiver resources, I think the Alzheimer's Association in the United States is one good resource. I know that in Canada, in the UK, in Ireland, in Australia, I know there are very similar resources, and I'm sure there are resources throughout the world. I just don't know about them in every country. And so those are some good resources.
Thank you. And just being mindful of the time here, I have time for maybe a couple more last questions. So one of my last questions here for you is, what are your hopes for the future of brain health research and the conditions of folks with dementia and their caregivers in the next, say, 20 years or so?
Sure. So the first thing I'll say is that some of the research that I do in my own lab is to work for better strategies and methods to allow people with mild memory problems to remember things better. So we have explored and have found successfully that pictures will help people remember things better than words. So if you have a loved one with memory problems, you're going to be able to help them remember whatever information you're trying to have them learn by showing them pictures rather than showing them words. We've also explored the power of music, and music can be beneficial for different people at different stages of the disease. When people are in the more sort of moderate to severe stage, music can trigger old, seemingly forgotten memories and help people remember some perhaps wonderful periods of their lives when they were younger, and that can be very helpful. Music can be used as a little bit of a memory tool. That's something we found in one of our early research into this area. And people of all ages can enjoy music and participate in dancing, which is a social activity. It's also an aerobic exercise activity. So it's really a wonderful activity for people to engage in. And in addition to supporting people that have memory problems, in the future, I'm actually very hopeful that whether it's with the same class of medicines that work to remove the amyloid plaques from the brain, or with a new class of medicines that have yet to be discovered, that we're going to be able to actually cure Alzheimer's disease. And I think the way that it will work is just like we currently get screened for colon cancer and for prostate cancer and for breast cancer. I think we're going to end up being screened for Alzheimer's disease. And once they detect that these plaques are beginning to form in the brain, they'll be able to give a medication, whether it's the current class of medicines or something new that will remove the plaques from the brain before those tangles develop and before the brain cells start to be killed. So that is the future that I am eagerly anticipating.
I love it. Thank you so much for sharing that. We are unfortunately coming to a close here of our Global Cafe, but before we wrap up, I would love to hear a sort of a last final takeaway message from you for our audience today. But just to give you a moment to gather that thought, I want to introduce our topic for our upcoming session. So we will not be having a Global Cafe next week in observance of Good Friday, but we will have one the following Friday with Dr. Anna Tadito, who is a clinical pharmacy researcher and professor with the University of Toronto. And we will be discussing exploring pain management during vaccination for older adults. So stay tuned for the invitation for that one as well. But now back to you, Dr. Budson. Do you have a final message for our audience that you'd like to share today?
Yeah, absolutely. So I would recommend that people, regardless of their age, work to have healthy habits for your brain health. So if if you think about, staying healthy throughout your life, which includes, wearing helmets, wearing seat belts, not engaging in dangerous activities, to eat healthy, to stay active, to stay engaged. These are things that are important all throughout our lives, whether you're young or old.
Perfect. Thank you so much. And such an informative session today. So I really thank you for your expertise and your time. You've been very generous with us. So thank you so much and have a good weekend, everybody. And we will see you on the next Global Cafe.